Welcome to today's NDARC webinar series. I'm very pleased to be your host today. My name is Sarah Farnbach. I'm a researcher here at NDARC. And before I begin, I just want to take a moment to acknowledge and show my respect to the traditional custodians of the land, wherever you're meeting from. I'm meeting today from beautiful Ngunnawal and Wurundjeri Country, and to show my respect to elders past, present and future. So today we're really lucky to have a fantastic presentation and a stacked panel. So I won't go on too long, and I'll hand over in a moment. So today we're going to be hearing about, the presentation title, is Deeper Understanding of Patterns of Drinking amongst Aboriginal and Torres Strait Islander Australians. And this is using the Grog Survey App, which I'm sure many of you will be familiar with. Today's webinar will be presented by Kylie Lee, who was born and raised in Darwin. Kylie is Associate Professor at Sydney University, and she's based on Naarm country in Wurundjeri Country, and she has an extensive range of research on drug and alcohol use led by communities and health service requests. Kylie is also the lead editor on an alcohol and other drug use textbook that's been used nationally, as well as leading a program of work around how to best ask about drinking and about drug use, particularly amongst Aboriginal and Torres Strait Islander communities. So after Kylie's presentation, we will invite our panel to join us, and we'll have a chance for some Q&A questions. So as you think of things during the chat, chuck them in the Q&A tab at the bottom of the Zoom call, and we'll try and get through as many of them as we can. We've got a great panel this afternoon, so I'm sure it'll be a really good presentation. So I'll just ask Kylie to please turn on her slides and her camera, and I'll hand over to Kylie.
Thanks so much, Sarah. Hi, everyone. It's really nice to be here today. I also want to, like Sarah, add my acknowledgement. I'm joining you here today on Wurundjeri Country, down here in Naarm in Melbourne, and just acknowledging that we're on Aboriginal land that has not been ceded, and acknowledging elders past, present and emerging. I'd also like to acknowledge any Aboriginal and Torres Strait Islander peoples in the room here today. So thank you for joining us. I also want to acknowledge this broader team of amazing researchers and project team staff. I'm really lucky to be here today to talk to you about this, about the Grog app study and the journey that we've been on, and how you might be able to use the app and the findings that you could collect on the app to inform practice as well as research. So particular shout outs to Jimmy Perry and Scott Wilson, who will not be unfamiliar to you guys, total amazing people who are actually joining in. You'll see them later on from Vancouver. They're attending the Healing Our Spirit Worldwide Conference. So thank you, Jimmy and Scott, for joining. Also want to acknowledge Kate Conograve, a professor, addiction medicine specialist. Jimmy, Scott and Kate very much with me were the nerve center, I guess, for helping coordinate and develop all the thinking that went into the app. So thank you to Kate as well. And lastly, thank you to Dan. In the spirit of street art that Dan and I are trying to bring to this presentation, Dan Wilson will be joining us as well from Alice or Mabantua in the panel. Today, I'm going to be talking about the app, but I'm also going to be sharing some research that we've conducted on the app, so we together can reflect how we can use it to inform practice and research, etc., and health promotion. And I'm going to be using some original research that's been led by James, Catherine, and Tegan. And I'm also the studies that James, Catherine, and Tegan led were based on data that Michelle Fitz and Jimmy led the data collection on. So a big shout out to Michelle as well. It really takes a village to do some good research. So what I'm going to do is, I thought we could start the story way back, if that's okay. So we're going to start with, why do we need to rethink how we ask about drinking? How do we currently do it? That's going to feed into kind of talking about some barriers, and then what does the Grog app offer in terms of some core features. Then I'm going to go into James and Catherine and Tegan's work in terms of, what can it tell us? And then particularly, how can it inform health promotion and practice? I'll stop there, but I think that's a really nice feed-in spot to go to bring Scott and Jimmy and Dan into the room, coming from clinical policy as well as on the ground prevention experience with community. So let's get going. So why do we need to rethink how we ask about drinking? Whenever I ask Scott and Jimmy how far back I should tell this story, they tell me far back, like go far back. So NIDAC is the National Indigenous Drug and Alcohol Conference, and it was in 2012. Scott and I were in the final kind of resolution session and really kind of talking about how, why do the surveys that we see, like national surveys, why do they not match what Scott and his other colleagues were seeing on the ground? In fact, I told Scott that some studies led by Tanya Secrecies from NDRI also show that, you know, if you look at Aboriginal people's drinking in national surveys, some surveys it's been shown to be out or underestimated by up to 700% in women and 200% in men. Yet it's this national data that government uses to inform funding allocation, which is why it comes back to Scott's point of, I'm seeing all of this need, but I'm not seeing the funding to go with the need. So Scott and I went to Kate Conograve. Some of you might know Kate has her PhD working on the audit tool, and we asked her to come in on us to help design a new survey tool. So we pulled together the team that I showed you on the earlier slide, and we were lucky enough to get one of the old project grants to make the Grog app. So it's obviously NHMRC funding, and the grant finished in 2021. So I guess it's where you start the story is kind of, it's important to kind of consider, you know, why is it hard to ask about drinking? And I think the first is because just simply many people, whether you're Aboriginal, Torres Strait Islander, Chinese, anyone else, many people just don't know how much a standard drink is. Yet all of the survey tools and screening items ask people about their drinking in measures of standard drinks. So I think that's a really tricky thing, tricky as well, to have to do the maths on the spot. I know that when we had a forum of people come in to help us work out how to ask about drinking in a tablet format, so in a digital tool, I remember being a bit cheeky, and I asked Scott and Jimmy and Rob Hassan, a wonderful drug and alcohol worker from Queensland, I said, you know, you don't want me to ask about usual drinking. Can I ask about typical drinking? And they were like, no, we need to be a bit more agile. We need to be a bit more flexible with how we're asking about people's drinking, because drinking can be episodic. So we don't just want to ask them to fit themselves into that monthly, weekly, most days or every day kind of box. So we really needed to go back and rethink, gosh, how are we going to do that? The other thing that Scott and Jimmy always told me about is that sharing of drinks can be very common. Drinking from non-standard containers as well. So perhaps someone buys alcohol and you know, cycling it or drinking it out of empty juice bottles, empty Mount Franklin water bottles, that kind of thing. Yet if you reflect on the alcohol.gov.au standard drinks chart, it's pretty much the wine glass, the nip glass, beers, etc. So again, it's really hard for people to estimate their drinking when they're already having to do the calculation of the standard drink, but then they're having to place the standard drink in the container that they might be using as well. So why else is it hard to ask about drinking? I think timeframes is another one. So as you all know, the National Drug Strategy Household Survey often talks about in the last 12 months, but our sort of groundwork with a range of Aboriginal and non-Aboriginal clinicians found that, you know, it's really hard for people to remember that sort of time period. So what can we do in a tablet format to help people understand the time frame that we're asking them about? Therefore, we can have a bit more surety that the answer that they're giving us is reflective of their personal experience as well. Also, a lot of shame around asking about alcohol. So I think that was one of the things we really wanted to feed into the app, is trying to make it a really safe place, non-judgmental. No one can hear anything that's happening in the app. Put your headphones on, and I'll show you in a second when we take a bit of a test drive through the Grog app. The other thing is just about worries about what survey info will be used for. Certainly, when I've interviewed Aboriginal women in outpatient drug and alcohol treatment services, there has been a worry about, you know, if I tell you, will my child be taken taken away, etc. So what we do on the Grog app is that we collect a birthday, say 14th of October, but we don't collect the birth date. The birthday is there because it feeds back as they go back and see the diary, but I'll show you that in a second. So this is the Grog app, the icon for the Grog app on your that you'll see on the app. And what we did is we realised after I felt like a billion wonderful meetings with Scott and Jimmy and Kate and other people that there was a whole story to tell in terms of how we developed the app itself. So obviously not going to go into everything today, but just check out the article if you want. It's freely available online. What I wanted to focus about were I think it was just good background to give you before we go into taking this test drive around the app is just the key principles. So we knew that it needed to suit Aboriginal and Torres Strait Islander peoples from an ethical approval perspective. It was 16 years for us because we didn't want to get parental consent as well. And then, but it really had to suit people that might have had a lot of tech comfort right through to very, very little tech comfort. And I'll tell you a wonderful story later that Scott tells, or maybe Scott can tell it later in the panel about white-haired Pitjantjatjara people using the app for the first time. It needed to suit a range of contexts. So whether you're with Dan in Mabuntua, Alice Springs, or whether you're with Scott on Ghana country in Adelaide, we wanted the app to be comparable and it needed to suit people from a range of contexts. So we spent a lot of time working out what words and what language and making it as plain English as possible. As I mentioned before, really wanting a comfortable place. So non-judgmental and just a place where people can kind of tell us their drinking story without having to do any mathematics. Really important for us is for the app to work offline. Jimmy would often tell me stories when he's traveling out in South Australia, WA, NT, and I would tell Jimmy stories in Melbourne when the internet would cut out as well. So you need the internet to download the app, but then the app itself, as well as the brief intervention that it gives you, is designed to work offline. And I think that's a major, it's a great feature. The app then can give the researchers who were administering the app a de-identified summary of completed surveys. And we've obviously designed it to be comparable with existing surveys. So Audit C, for instance, a modified Audit C is on the app as well. So let's take a bit of a spin through the app. Scott, you need to hold yourself back. Scott normally gets to do these slides. So this is the first question, if you like. First of the alcohol questions. I would have just done a whole lot of demographics questions as well. You can see straight away that there are two women here. It's because Talia, our wonderful research assistant, said that she was a woman. Therefore, most of these screens, I think, are women. So we're matching the gender accordingly. I was talking before about the last 12 months. So Talia got these screen grabs pretty recently because, as you can see, it's telling me the last 12 months, that is, since the AFL or NRL football grand finals last year. So it's always giving an anchor point. And there are 4 anchor points that we use in the year, whether that be Christmas and New Year, Easter, National NAIDOC, or the footy grand finals as well. Up the top, you can see I can always change the audio as well. So maybe I said I was a woman and I want to listen to a male voice for whatever reason, or maybe because I know that Jimmy Perry is the male English voice. I want to listen to Jimmy's voice, so I can click on the drop down. The app is also available in Pitjantjatjara. We chose Pitjantjatjara on advice from Scott and Jimmy, and I thought it was a great choice because the babies speak Pitjantjatjara as well as it is taught as a language at a major university in Adelaide as well. So a lot of very, very knowledgeable Pit speakers about. But the work that Scott and Jimmy and I are doing on the app means that in time you'll be able to add any language. You could add in Chinese, another Aboriginal language, Warlpiri, whatever. So I might have said no on this question. And if I say no, the clinicians on our team really felt like it was important to have this check question because not everyone is going to identify themselves as a drinker per se. So again, we're asking them, but hold on, at special events, sporting carnivals, wedding funerals, have you used any grog at all? And it was really important. We're actually writing a paper at the moment about this check question and the number of people who went through and said no to the previous question and came through and had the check question here. And it's certainly something that our clinician friends use a lot when they're doing a clinical interview with someone coming through the door. I mentioned before about how we want a non-judgmental space, and we use timeline follow back in the app as well. So, you know, you need those soft landings, Robertson always tells us. So you don't want to straight away say, okay, so you use, so tell me what and how much. I want to jog people's memory and I want it to be gentle. So where were you? And I can select a number of these fantastic pictures drawn by Franz Varga. And how many people were you with? So again, just the location as well as trying to remember who you were with. And then we go into what we would call the main grog shot. So this is the top level. What types of grog were you drinking that day? Others has things that we found were not as common. It has cocktails, it has metho, it has homebrew, it has vanilla essence, mouthwash, that kind of thing. So I mentioned before about the non-standard containers. So you can see here there's a range of them, and the app is designed to be flexible, so I can always add in more containers as well if there's a particular bottle that people are siphoning into. And then I can basically pull the hand up and down, and the app is doing the maths for me, very lucky, in the background. Particularly when it comes to wine and spirits, we found that some people add in, whether you're adding in lemonade or Coke or juice or whatever. So again, you can press on that fizzy drink because some people were just filling it up to the top. And then I'd say to them, was it totally filled to the top? No, I'm adding in Coke as well. So you can, because we really want, of course, just that estimation of the alcohol content. And then in the back end, we've got all of these containers that have the volume, and each of the alcohol types has the strength of alcohol. So again, it's just really nice to be able to ask the app to do the maths for us. And then I'm sliding it across. So Talia's got a different container here of the sports bottles. So I'm saying it has, how much did you drink on that day? And it's pulling it across. And you know, for some people, they do find it easier to describe what the whole group drinks. So what we do is if the app for any one alcohol product that's placed into your grog cart, if you like, if it's equivalent to more than 7 Australian standard drinks, it'll bring this pop up. So just wanted to check, was it what you or the whole group had? Obviously, no point us doing this for the person just had 1 or 2 beers. And we didn't want it to be like an annoying pop-up feature. So, but that again, if we were doing another study, we could change that threshold. At the moment, it's set as 7, which was on recommendation from our group of CIs. So I can say that it was the group, and it'll basically show me an equal share based on how many people I put in my drinking circle. And then I can say, for instance, that yeah, on that day I was a bit greedy and I had more than that. This is what we call like the detailed grog diary, because in addition to the modified audit C that I said that the app uses, we're also using the Finnish method or modified Finnish method. So from Alanko in 1988. So what Alanko did was that he's asking in detail about the last 4 occasions of what you drank, and then you obviously get the dates of those as well, which is why it's important for us to collect someone's birthday, that they see it back on the diary. What we found is that we could ask about the last 2 occasions and we'd still have 97% accuracy compared with if we asked the last 4 occasions. So it's quite a lot to ask on people, to ask the last 4 occasions. It's just a lot of asking. And what about the time before that? What about the time before that? So we ask about the last 2 occasions in detail where you actually get to put things into your grog cart, and then we ask the date of the 3rd and 4th to come up with a median per drinks occasion. And you can also, of course, come up with an average per drinks per day. I'll show you some of that data in a second. Our clinician friends said it was also really important not only to ask people about when they drink, but when they don't drink. I was speaking about this earlier this year with Dan in Darwin about how if you're collecting data on dry patches, it can be really useful to inform, likely risk of withdrawal as well. So we do that as well. So again, with the same anchor point. So in the last 12 months since the footy grand finals, have you had any grog? Have you had time of no grog at all? So we're after here a consecutive period of no drinking. And I can pull it across from 1 day up to 11 months and 3 weeks, because as you remember, we're just asking about the last 12 months. We also ask about dependence, and I think last year or the year before, Tegan Weatherall presented on her PhD studies that James Conogrove and I supervised. So we ask 3 3 questions on the app to look at likely dependents. So 3 ICD-11 questions, and this is just one of them that you can see here. Very deliberately, the background of the app changes as well, now to blue, just that visual reminder that we're not in the consumption section now, we're asking about dependents, which is kind of good to visually mix it up for the participant as they go through. When we put in the grant to NHMRC, we actually didn't say that we were going to do a brief intervention, but it was like the second we got the grant, I remember having conversations with Scott about, oh, gosh, we can't take people's data. We've got to, straight away give it back. And what a unique opportunity to be able to give them immediate feedback, immediate response based on their unique survey responses, mine different to Scott's, different to Dan's and Jimmy's. So everyone receives immediate feedback delivered via the same app. So basically you've clicked off from the last survey questions. We've got how you feel about the app in terms of your user feedback. And then it straight away places you into what you see is this risk triangle that's based on WHO alcohol brief intervention tool that Kate worked on and adapted for an urban Aboriginal and Torres Strait Islander population in New South Wales. So it places you here. And then basically using the flags framework, so feedback, listen, advice, goals, and strategies, we're trying to mimic Kate or Dan or Jimmy giving feedback to someone as if they were doing a clinical interview, but we're doing it in the app. And it's been a really interesting process to think of how you can reflect the myriad of user journeys that you might have of someone, because obviously some people coming in down here, you can see are not drinking at all, and they could get information from the app that could benefit a loved one that they might be worrying about. And then you've got, low risk drinkers are people drinking within the guidelines, and then the risky and the high risk. So it's been a really interesting process thinking about how you can use the functionality and the emerging technologies to convey the information in a way, again, that's safe and gentle and obviously evidence-based. The evidence-based bit was the easy bit because we had lots of clinicians and researchers on the team. So there are lots of tips if someone wants to cut down on grog. If the triangle thinks that you are likely dependent, then it's going to show the stop. So tips if you want to stop first, and then it'll show cut down if they can't. And we also have harm reduction tips as well. So this is one particular screen reminding people about if they can't cut down, if they can't quit, then they could consider asking their doctor about thiamine as well to help protect the brain. So before I go into telling you some of James and Tegan and Catherine's findings, I kind of wanted to show a couple of screens just about the flexibility of the tool, because I think this is really interesting. I love the data collection bit. I've spent a lot of time, working with communities, or particularly pre-kids, and it's just so wonderful having a tool that can kind of take away some of that research assistant stress in terms of it's so hard to be out there collecting papers, having tracing sheets and that kind of thing. So the content management system, if you like, behind the app is called Umbraco. And what it basically means is that we've got this flexible tool where we have a separate RA dashboard, research assistant dashboard. So I could be telling the RAs exactly how many people we want to see, how old they are, and at different sites. Maybe there's one site in a hospital, one site in a school, one site in a prison. But at the same time, I can also be adding in different questions as well. So we've clearly got the questions on alcohol that I've showed you. We also ask about treatment access. We ask about harms. But just say, Scott was really interested in asking about experience of alcohol restrictions, alcohol policy stuff. We could just add in those questions as well. So it's really unique to find a way that communities can kind of in time be able to direct what questions are being asked, questions that are going to meet their priorities. I kind of see it. James got me this wonderful kind of picture of, I don't know where he is, maybe in the States or somewhere, some byways and highways going all over the place. I kind of see that the byways and highways are kind of like the conditional pathways on our app. Like when you fill in the census or when you fill in the National Drug Strategy Household Survey, and it says, if you said no to question 10, then go through to question 17. Or if you said yes, then go through to question 25F. The beautiful thing about the app, and I'm actually designing the conditional pathways for an app that Scott and Jimmy and I are building at the moment, is that if you want to add in something, I could I basically reset those conditional pathways so that the highways still work and that the app links the person up to the question that they're meant to be getting. And it's really useful to have this unique flexible tool to enable us to do that. So what can it tell us? And I'm thinking in particular, what can the app tell us, to inform local efforts around drinking? So as I've kind of talked to you about already, the app doesn't make people fit into a particular drinking box. They tell their story. It does not assume that people are comfortable with maths or reading. So again, they just focus on telling their story, picking the pictures, pulling the sliders up and down. And we have found the app to be an accurate tool in measuring drinking, and that was compared with clinical interviews done with Aboriginal health professionals in 2 states, so urban Brisbane and remote and regional South Australia. So what I wanted to show you now is some data that we've collected on the Grog app from a community representative sample in South Australia. So again, gigantic shout out to Scott and Jimmy for leading this part of the study, and Michelle Fitz for leading the data collection. So just to give you the really super quick rundown, there's an urban site and there's a remote site. In the urban site, and if you're interested in this, so many people say that they recruit a representative sample, and I often find it's really hard to work out how they worked out it was representative. So we actually specifically with James Conner-Grave, we wrote a paper demonstrating how it was representative and how we did it. So basically it was a quota-based convenience sample that was stratified by age and gender, socioeconomic status. And we actually, thanks to Jimmy and Michelle and our other South Australian RAs, we were able to recruit more than 1/3 of the local Aboriginal and Torres Strait Islander population. So that's, for me, that's massive in an urban site. In the remote site, Jimmy and I have done a lot of stuff remote, and Dan lives remote. So we basically went to everyone in the community, and that was age 16 plus. Everyone, according to ABS, is 55 people, but we actually interviewed more than that. So data collection happened over a few months in 2019, and there were 12 research assistants. 9 of those were Aboriginal people. And we just asked everyone just to complete the app once. So I'm going to show you the findings. In order to show you the findings, I kind of just need to tell you a little bit about the people that we spoke to, or the people that filled in the app. So 775 people, and mean age was 38. So about 1 in 5 spoke an Aboriginal or Torres Strait Islander language at home. And interestingly, in terms of age, the language spoken at home, and the median income earned, our study was bang on in terms of comparison with census data in South Australia, which is one of the ways we were able to say that it was representative. So this pie chart, I know it looks boring, but it was really interesting to me. And I was talking to Dan about this today. So it's kind of showing of those 775 people, where do people sit in terms of the broadest look in terms of their drinking status? And see here, you can see 77.1% were current drinkers. Why I think that's really interesting is because you might often read Aboriginal and Torres Strait Islander people drink, they're less likely to drink, but if they do, they're more likely to drink to riskier levels. Whereas when I was talking to Tanya Sucraces from NDRI about this finding, Tanya's a CI on the grant, she was saying, that's really interesting. That's very close to the national data in terms of the general population of current drinkers, which is kind of like 3/4. So I wonder whether we're getting a higher proportion of current drinkers because of that check question, or because we're making it easier for people to tell us their story about drinking. But it was just really interesting for me to see that. So these figures are not surprising to us. So when people were drinking from a median standard drinks, it's double the NHMRC guidelines, but when you smooth it out per month, you can see it's barely anything. It's less than a standard drink of beer. Men more likely to drink more than women, you can see here in terms of their per month and their median standard drinks occasion. 75% said they had a period of a dry patch, which was really interesting to us and interesting to our clinicians locally in the area in terms of how they therefore target the treatment and prevention programs that they're doing with community. And if you're looking at those dry patches, there's actually 60 consecutive days for men and 90 consecutive days for women. So again, that was just, there are no other surveys that kind of no current surveys anyway. Ernest Hunter did collect data on dry patches, but that was in the Kimberley in the early 90s, that kind of look at this non-drinking side of someone who has currently drunk in the last 12 months. And you can see here the disparity there. I thought it was really interesting in the urban site that where people have more access to pubs and clubs and alcohol in general, that they have longer dry patches than the remote site. I've done a lot of health promotion over my time and lived remote and done a lot of community development. And I think this is where the app really comes into its own. So we can actually see here that, you know, in the remote site, people were more often drinking beer, where in the urban site, they were drinking other sorts of alcohol. And on the app, we deliberately kind of haven't put brands here, but it'll actually show you exactly what brands and exactly what containers as well people were using. So we were speaking before about non-standard containers. So you can see here that 40%, more than 40% were using improvised drinking containers, is just like the non-standard containers that alcohol is not sold in. And then here you can see a breakdown of those containers by remote and urban. And I was talking with Dan earlier today about how wouldn't this be so useful when you're giving a brief intervention for someone, or when you're designing a health promotion activity, to be able to actually tailor it to what you know is the most common beverage or the most common container type. Then it's going to have meaning for the person or the group of people that you're trying to talk about drinking with, just so that you're really tailoring it to that local experience. I'm going to present really quickly on some of Tegan's stuff. So Tegan found that 1 in 45 people, or 2.2% of people, were likely dependent. And that's very similar to the Marie Thiessen's study from years ago, looking at national dependence data. I think that study came in at 1.4% or something, I guess. And tremors were the least common from Tegan's work. I guess this is not really surprising, and I'll show you her fancy graphs, as episodic drinking, you know, can be more common amongst Aboriginal and Torres Strait Islander peoples. And we know from talking to clinician friends that tremors are more likely seen in people with chronic, daily, heavy kind of consumption. And tremors are not always seen when someone stops drinking. So you're seeing those dry patches as well. So again, really interesting to see how this sort of data can be used to inform, you know, what Dan and others are doing clinically. James led a study around motivations to drink, which was also really interesting. So again, questions that we added in on the app. James comes from a psychology kind of background. That's where he did his PhD. And it was really interesting that people felt most autonomous or in control over their life. They felt most competent and they felt most connected to other people around them. In James's world, that's called basic psychological needs. So they felt most in control, most competent, most connected when they were drinking more, or if they were likely dependent. And for me, this was super interesting in terms of pointing, if we had that data for a particular community, and obviously you need to go community by community because we all don't fit in the same box, it really points to how important it is in the communities that we went to think about clinical and public health ways or strategies that we can prioritize fostering people feeling more connected and feeling more autonomous and feeling more competent just in their everyday life. But again, having this information there and it's speaking to you and having the visual images to make it easier for people to answer this full experience about their alcohol use behaviours. So really quickly, what does it all mean? Well, we know that this is it's the only tool of its kind to measure how much and how often people drink. So validated, obviously, for Aboriginal and Torres Strait Islander peoples. And what I think is really interesting is how it can shift that power. So, often communities don't have an epi expert or a biostats expert or any kind of, very much research capacity, but having something like the app can really help them monitor drinking locally and to be able to use that information to tailor prevention and treatment efforts. Communities, in my experience, are typically not able to determine the success of their efforts by monitoring alcohol consumption per se. Instead, they're left to monitor kind of, downstream events such as major alcohol harms, car accidents, ED visits, that kind of stuff. And I think it's really interesting to look at how the tool can level out the playing field to give communities the opportunity to monitor how they're going with drinking and then to make tweaks to the design of their efforts to do that accordingly based on the data. I've spoken a lot today about how, you know, many other survey tools assume regular drinking. And for us, as you could see, with that 77.1% who are current drinkers, that's really going to exclude many drinkers. So, you know, we're not asking people to fit themselves into I drink monthly box, because people simply can't fit themselves in a box. They drink episodically, and they might be having long periods of dry patches as well. And I think it's really interesting to think about the health promotion materials around alcohol, because, you know, they can't assume that regular drinking pattern, or that an individual can convert the guidelines on alcohol use from the standard drinks. And I think this goes way broader than Aboriginal and Torres Strait Islander peoples, because certainly I've seen it in the work that I've done amongst young people as well, who can drink episodically. So where to from here? So as I said, we've got this flexible and customizable tool. It's available for free to communities and health services. We've got two versions. So Scott in particular wanted a health promotion version, which means it doesn't collect data, but it gives people a chance to try out the app. And it still hooks up perfectly with the brief intervention. So you can try out the app, you can get the brief intervention. And I know some services that use that as a way to ensure that people can get a consistent, systematic brief intervention based on what they enter into the app. And it's great because we're not saying to people, tell us what you drink, because we're not going to get the data. No data is collected. But I've had some people fill it in, think because they're worried about their dad or their cousin, and they're just wanting to see where it puts them into the triangle and what sort of tips that the app would give you in the brief intervention. The app can also data capture. So that means registering with us. We set you up with an account in Umbraco, and you can use the app to actually collect data. Samary's collecting data on the app at the moment in a MRFF funded study that they're doing around Aboriginal women and their support people, and they're asking in particular about alcohol, but they also asked Scott and I to add in 17 questions around Yandi or cannabis as well. So it's been really interesting experience supporting Samary through that. They're about halfway through their data collection. And next year, in terms of where to from here, we've also got an MRFF grant starting, which is really, it was actually, I guess it was Scott, Jimmy, and also Noel Heyman, a professor and clinical director of Anala Indigenous Health Service. I guess as we designed the app, as I've spoken about, it's designed as a population survey tool, but it was really, I guess we were lucky to have so many clinicians on board. So we were, I guess in the back of our minds was, could it be a screening tool? So this tool is going to look at that. So can we make it easier for clients and clinicians in primary care to talk about alcohol? And that's something that will start next year. So really interesting, and actually getting the app to talk to patient software. So we're looking at best practice in this case, which is used by 3/4 of the primary care services around Australia. And it's a really nice intersection point here, because we've got a lot of techie people on board, as well as the clinicians and Aboriginal and Torres Strait Islander kind of experts and health professionals, as well as people like me. In development as well, we are also, we've got a current ideas grant. So we are at the moment extending the Grog app to also ask about tobacco and illicit drugs. Jimmy was telling me before about, cases of fentanyl that he's been reading about and hearing about in Vancouver, where he and Scott are at the moment, and fentanyl as well is one of the drugs that we're going to be asking about in the opioid-based painkillers section. So that's exciting. We're going to go validation study out for that next year. And eventually the Grog app, as you know, it will become part of the drug app. So you could just use the drug app to ask about alcohol, or you could use the drug app to ask about one or more drugs. I just wanted to finish with this screen because A, I love it. B, it matches the shirt that you're about to see on Jimmy when he comes into the room. But C, it really reminds me of how it does take a village to do really good research, and we're very lucky to have such an egoless, wonderful mix of researchers and clinicians to help us design it in such an iterative way. These are some of the South Australian researchers who helped leads the data collection that I reported the findings of. And this is Michelle Fitz is on the opposite end to Jimmy. So she's the woman with the sunglasses on the right-hand side who led the data collection. So a really big shout out to those guys. It really answered a lot of questions for us in terms of how you can work with communities in the right way to recruit representative samples and really very much be led by local people. So you're kind of prioritizing research, but doing it in their way that's going to be best for them. Thank you, Sarah.
Thank you, Kylie. Wow, what a fantastic presentation. We've covered a lot of a lot of areas today. That's great. Thank you. Someone's going to turn my light back on. Wow, that's great. I mean, it's so great always to see work to make health systems and tools more appropriate, accessible, meaningful to all the diverse people across Australia, particularly Aboriginal and Torres Strait Islander people. So I'm particularly fond of this piece of work that you guys have been doing. Congratulations. So without further ado, I'm going to introduce our fantastic panel today. Dan, do you mind just turning your camera on? And I think we've got Jimmy. Yeah, perfect. Oh, hello and welcome. So firstly, we've got Dr. Daniel Wilson, who's an addiction medicine specialist. He lives and works in Alice Springs, so in Barntua, and is the clinical director of alcohol and other drugs in Central Australia. He's got a background working in rural primary healthcare as well. We've also got Associate Professor Scott Wilson, who really takes no introduction. He's a national leader in drug and alcohol, the CEO of ADAC, is co-director of the Centre for Research Excellence at Sydney University, focused on drug and alcohol. We've also got Jimmy Perry joining us today. Hello, Jimmy. Joining us from who is Nijinjeri Aranet man and has worked on several projects, large-scale projects, including making tracks, which some of you will be familiar with. He was awarded the APSAD First People's Award a couple of years ago and has been working in the field for years and years and years. So I won't take up more time. I might just start by maybe asking if there's any reflections from the panel about the presentations. I might maybe start with you, Dan, if you had any reflections about the presentation in the kind of clinical context, I guess, how you might use it in your work.
Thanks, Sarah, and thanks, Kylie, for such a wonderfully presented piece of work. And the reflection that comes to mind for me is the opportunity to create a shared language of information sharing among clinicians and people who seek services or attend services in relation to substance-related harm. The reflection I have is that when we talk to junior doctors and medical students and our colleagues about the idea of taking a substance use history, taking something from someone is very one-sided and is about removing autonomy in a lot of ways. So I really respect with this app the idea of creating a conversation which is two-way information sharing, where people are telling their story in their way. And so the way substance use and alcohol use comes across then is really relevant to that person. It places it in the context of their life, their relationships, events, circumstances and situations. And it gives us as clinicians the opportunity to have a degree of presence in that person's story rather than taking something to then tell them something. That's what I reflect when I hear Kylie talk about this app.
That's great, thanks. Yeah, I mean, I think that's a really nice point, isn't it? That medical interaction can be quite one-sided, sort of traditionally. So we've got Scott and Jimmy joining us from Canada. So thanks, guys, for dialing in from the other side of the world in the middle of the night. Maybe I'll hand to you now, Jimmy, before asking Scott to add a reflection as well. Did you have any thoughts, Jimmy, on the presentation?
Oh, definitely. I think, when I went off to do some of the recording of the information and doing a whole community was just a little bit mind-blowing to think that, we're able to gather all that information from 16 plus and, with everything I've done and heard of and read, there hadn't been anything done similar to that. So to be part of that, it was like awesome, like to really be involved in that. Mind you, let me tell you, just it's about 10:45 over here over in Vancouver. So I know Scott and I, we just left a couple of meetings, within the last hour, and it's getting that way. It's getting pretty tiring. I can see Scott's starting to roll his eyes and about to go to sleep, so I'm not far behind him. But I'll let Scott say something.
Thanks for making time. Yeah, over to you, Scott.
Yeah, look, I think, and it's interesting, Kylie brought up about the, the percentage of people that were drinking. And I really think that it goes back to, you got to think about it, like in 1994, so that's how back, there was a paper supplement in the National Drug Strategy Household Survey, right? And so that sort of quote, that Aboriginal people abstain more than non-Aboriginal people, but those who drink at levels that are harmful to the health, came from that 1994 household survey. So that's nearly 30 years ago, and nobody since then has ever really challenged that. And so everyone just keeps repeating the same sort of dialogue. And so it's interesting that here we are in, a more tech savvy sort of world where you're able to sort of get people to, anonymously, confidentially, put their data down, and lo and behold, it actually does show that Aboriginal people drink at the same rates as Indigenous folk, non-Indigenous folk. But it obviously clearly shows that they drink at levels that are harmful to their health. So that was quite clear. And that might sort of solve Kylie's dilemma when she was talking about it. But look, we had a great time, I suppose, in when we were sort of trialing the app, like, for example, in some of the remote communities that we went to, even though English is a second and third language for some of the participants. Some of the older members who'd never used an iPad, basically, were able to use that without a problem. And it's really interesting that, and especially for Dan and that, who live up in Alice Springs, for example, where they might be watching Imparja TV, they might be listening to Karma Radio, where there's songs will come across in language, but there wasn't actually anybody asking people directly about their alcohol use in Pitjantjatjara or language like that. And so some of the older, more traditional folk, when they started using the app, actually did break down and sort of got emotionally affected, because it was the first time that they were hearing somebody asking them questions about their alcohol consumption in their own language. And so to me, that was really exciting, and it sort of shows that if you put the information into the language of the target group that you're sort of looking at, you will get the results that you want. And so we're sort of excited. I know other web-based tools that some other researchers have developed have also taken our lead now, and because they come and spoke to me and Jimmy in Adelaide about making sure that their app isn't just in English. It is going to be in Pitjantjatjara and things like that. And I know that when we go down the track of doing the new app, the drug app, then that'll be in Pitjantjatjara as well. And it gives people the choice, right? So they can either hear it in English, they can hear it a male or a female, they can hear it in their own language if they so choose. No, we were excited. We're still excited. I could sit here, even though Jimmy was right, I was sort of getting a bit tired there, but I can sit here all night and talk about the Grog app, because I think it's a fantastic tool. I think that, the more I was talking today, for example, here in Canada with some Canadians about the fact that about the Grog app, and that, with minor modification, such as what Canadians alcohol products are, and whether they use 30 mils or standard drinks or whatever. You could actually adapt the app for any group of people worldwide. So to me, it's got a worldwide application, not just a local Australian one, and it's something that we should look at as we're moving forward. So
it's really interesting you say that, Scott, because I've got some people at the moment who are, it's really about interested in adapting the app for culturally, linguistically diverse populations as well. So populations where disclosure of drinking has a lot of stigma attached. And so, yeah, I agree. It has a lot of kind of applicability to various priority populations in particular.
Yeah, no, look,
Yeah,
it's a great tool. And, I do know that I've seen people use it in their own sort of practice to get, results. And also, as you were saying, I think it was you that, so the report that you get out for the individual is graphic, and so they can actually see. And the interesting thing is, people will sort of, once they sort of saw what their data was in that graphic sort of presentation, and Jimmy would probably agree that a lot of the comments were, oh my God, I knew I drank. It was when I was drinking a lot, but I didn't realize I was drinking that much, right? And so, some of the comments that we got from participants were that after they saw that they were now going to cut down on their drinking. It also showed them graphically how much money they were spending, right? On the grog each time that they sort of had a session. And so it is really interesting. And like I said multiple times, love being involved and love to see the app roll into something bigger.
Yeah, great point. I mean, that's so powerful, isn't it? Just that reflecting information back to people. I mean, we all love tracking our stats and data and exercise and everything. So it just makes like really good sense, I think. Just picking up on that point, Scott, that you've made there, I think there's a couple of questions in the chat about, sort of what next for the Grog Survey app. And the first question is asking, are there plans for it to be incorporated into any of the national surveys, like the National Drug and Alcohol Household Survey? And while I'm asking that one, I'll just add on the next one, which was from Don, asking about, or more of a comment really, but saying it would be interesting to compare some of the findings that you've had from the Grog Survey app with the alcohol questions from the National Household Survey as well. So over to you, Kylie, to tackle those.
I might do Don's first. I think the most recent National Drug Strategy Household Survey, they did collect data from Aboriginal and Torres Strait Islander peoples, but my understanding is what they reported on was only from the NT. And I can't remember, Dan, if you can jump in. It's either only urban or it's very specific, the data that they reported. So we found that we weren't able to directly compare it because we didn't ask non-Indigenous peoples. We only asked Aboriginal and Torres Strait Islander peoples. But it was very much because that's exactly what we did, Don, in terms of we compared the demographics of people who completed our survey with the census from exactly the same community. So I was hoping to be able to do that, but I'd love to be able to. In terms of the first question, Scott and I have been, we definitely have been trying to reach out to the mob at AIHW. I think it'd be really good to, and I saw Scott had recently emailed Naya as well, so Linda Burney's office, around talking about the app. I think it's kind of just on the list. We don't have any plans at the moment. We haven't had any of those meetings, but I can clearly see like that's the purpose with which the app was designed as a population survey tool. I think it would be really interesting and to do more than what the National Drug Strategy Household Survey does, because they did do their online version, but it's literally just radio buttons and there's no, there's no kind of visual images of the alcohol, or you're stuck with, I think you need to flip out to a different screen to see the standard drinks chart. So I agree. We're still kind of just trying to get into that space a bit more, but I'd love to see that.
Yeah, there's no way that could be as accurate as there when you look at the detail.
No, it's not. And we have tried God, you know, going back a few years, we did contact the Australian Institute of Health and Welfare. Initially, they sounded interested, but then they just went really cold on the whole idea, right? Which sort of surprises me, because the app does give you a fairly accurate sort of, well, far more accurate than what they're getting from the household survey. And the household survey really has to, you know, at the way they do the survey, right, and the randomization of the phone calls and that. So, you know, you need to have people that have got a phone for a start. But they also miss a lot of people that, obviously, the people that should be included in those surveys, which are homeless, transient people as well, who again might not actually have a phone and therefore aren't getting asked these questions. So it's interesting. We have asked NIAA, their director, of alcohol, that we've sent them a link for them to have a look at the app, and sort of told them that we're willing and able at any stage that they want to have a little bit more of a presentation and a discussion, as well as the Department of Health and Ageing. So I suppose really you can only keep banging on a door before hopefully someone might open it, right?
Yeah, policy change takes
Or
time.
it could be like a lot of Australian technology advances, they go overseas. Money kidding, right?
Yeah, no, that's great. Great reflections. I can appreciate the amount of discussions that you've had, and it'll be ongoing, I'm sure. I'm conscious of time. We've got maybe just a minute just to reflect. There's been a couple of questions in the chat. There's a lot of interest, it seems, Kylie, around where people can access the app and how can they get it as part of their clinical care. Perhaps you could just, you know, talk to that for a couple of minutes before we hit our 4 o'clock buzzer.
Yeah, I think I actually just answered most of those questions. So yeah, just ping me. My email's in the answered. I think you should be able to see the response there. The app's not available publicly because some of our chief investigators had been a part of developing other apps before in the alcohol space and had found those apps to be sequestered by the alcohol industry. So just ping me and one of our team can send you a link. If you have 2 iPads, it only works on an iPad at the moment. The drug app, when that we're going out to do the validation study of the drug app next year, and then it will be available from after that. The drug app is being designed as a progressive web app, and what that means is that Dan could use it on his laptop in his office, or I could use it on an Android tablet or an iPad tablet as well. You just we started it such a long time ago, like 2015, and at that stage, iPad was really the best way for us to go forward in terms of the visual, interactive, engaging, smooth sliders. It was just the best technology available back then. But just ping me and we can get you a copy of the original Grog app. That is, the drug app's not available yet.
Fantastic, thank you. Well, I'd just like to take this opportunity to really genuinely thank you all for spending some time with us today and telling us about this fantastic piece of work and what you think about it and how to get it into practice and what we should be doing. It's really great to see this. Really, I love this like innovative stuff that's in practice and changing things straight away. It's always really exciting. So thank you to our panelists and thank you to Kylie. And I'll just wrap up by letting you know about next week's webinar. Hopefully there's a slide coming to let you know what's coming for next week, same time, same place here at NDARC. We're lucky enough to have a presentation from around the long-term patterns of heroin use and mental health on next week at 3 o'clock. So thank you everyone and have a lovely afternoon.
No worries. Thanks for your time.